I think by and large people want to be understood and validated, and this is the last thing that someone wants to hear is it's all in your head or there's nothing else left to be done. Nothing can be done. I'm Dr. Bruce Stevens. I've been in practice for 30 years and decided to focus more on neuropathy, in fact, solely on neuropathy. That community that suffers from neuropathy is really underserved, and it's a growing problem that really is having a huge impact on people's lives. So we decided that, what are we here for? Are we gonna do the same thing that we've done or explore something different? And that's why we decided to focus strictly on helping people with neuropathy.
Being a chiropractor there's this intelligence in our body. It's finding all the right components to bring it together so our body gets what it needs to heal and rejuvenate.
What we bring to the table, especially when you're talking about neuropathy, is if you took the word chiropractor out and substituted it with somebody who looks at things differently than the standard medical system, and I appreciate that system for sure because it saves lives and it's a wonderful system. But this is just a different approach, and a lot of times that's what people need.
Being from a football family, we always had team doctors. So we always went to the Atlanta Falcons, the Denver Broncos, their doctors. My dad, he went there and he always said his feet were numb and that he had this burning sensation. He'd come home at night and as time went on and he got a little bit older, he couldn't walk and he lost his balance, and then it got him. I started feeling some of those same tendencies, and I said, you know what? God showed me this early on. I need to go, find somebody. And it was that day that it came across my Facebook page, Woodstock Health Institute. And then I said, you know what? That's a God thing. But it took my dad going through that for me to truly see that I had to get something done about it. If it wasn't for that and that me seeing that ad, I don't think I would have came. And now it's been the biggest blessing for me.
Don't accept the way you are as being, okay, I'm old and that's just the way it's going to be. In the last few years, I've noticed that my balance was off. Balance is absolutely critical. So if you can come here and improve your balance as well as pain and all that in your legs and feet, do that. It's certainly worth it. John and Bruce and Renee care about the people that come in here, and that's so obvious.
I was diagnosed with triple negative breast cancer, which is what brought me here because I got really bad neuropathy in my feet from the chemo. They told me that it was a side effect from the chemo, that it had pretty much damaged the nerves in my feet. The older I get, the more I like to take a holistic approach, and I feel like there's other ways to heal the body and to make your body function better. And I think that people here at Woodstock know that. They've put the time and the effort to learn these practices. You would do yourself a disservice by not at least contacting them and seeing what they have to offer.
I'm a diabetic. And a lot of the people that have diabetes will have a tendency of having a problem with neuropathy. And I happened to see on Facebook, of all things, a free test for neuropathy pain. The first day that I came in here and, they kind of have you fill out a form about what issues you're having, and I'm looking at that form and I am like, I have almost all of these. You felt like you had the support the whole way. If you had a question, they had an answer. If they didn't have the answer, they would find the answer. And that's what I was looking for. Woodstock Health Institute has given me my normal life again. It is a life that I can enjoy instead of sitting on the sidelines. I know I'm getting older, but I'm not old, and I still want to do. And now I'm doing again. So yes, it's been a fabulous journey.
I realized I needed to have and was told I needed to have a hip replacement. And at the end of that, I kept feeling my left leg was giving me some difficulty, and I didn't understand why. The first doctor, not the hip doctor, but the one he sent me to, said, I've told you that you've got neuropathy and there's nothing that we can do for it. I came here, they did an exam, then I enrolled in his program, and I have some equipment, of course, that I do at home. I feel so much better. I can walk better and I can do things that I couldn't do before, and I'm just so forever grateful. And I'm walking a little faster, just a little. I definitely would tell people to check it out before they agree that there's nothing that can be done, because that's not true.
If you've been told nothing can be done and you struggle day in and day out, and it's affecting your sleep, your relationship, your quality of life, and you've been thinking there's got to be something else, there is. And you just got to pick up the phone, make a call, come in. We make it so easy that it doesn't even cost anything just to come and see what we're about. Because you come in here, you're going to learn something new, and you're going to find out that maybe there is something else, that maybe we can help.
That whole process only exists when somebody has an open mind. If somebody can come here with an open mind to just find some answers, I think they'll be surprised at what they find.